Our Health Inequalities research programme is based around 4 key areas, which are governance, data analytics, research studies and workforce. Basically what we wanted to do within these areas is to look at how we can improve and address health inequalities across the research landscape. So for example, when we look at governance, we look at the structures that support research, whether that's expressions of interest, whether that's how we document research, but really to look at, well, what are those processes that we can change within our own systems to address health inequalities. When we talk about data analytics, we also look at that wider than our research innovation, but we look across the trust, look across the whole of the Northern Care Alliance to say, well, what do we need to do? What data can we capture around demographic data? And obviously that's on a national basis, looking at census, but also what do we know about our local population as well? So that's a really important area of work when we're talking about data and how we collect data and how we store that within our electronic patient record and how we can use that to tackle health inequalities by looking at where the gaps are, looking at gaps in the patient population for us in terms of representation within research, but then where do we need to focus as well. Moving on then, when we look at research studies, which is another of our themes, we also wanted to look at, well, who is taking part in research? Again, it ties in with those other areas, but what research studies are we taking on? And can we use the range of research and the skills that we have and the expertise that we have across the whole of the research programme and across the research work at Northern Care Alliance to really address some of these issues? So can we take on more studies that address health inequalities? And can we make sure that the studies that we do actually support and the studies that we have don't exacerbate existing health inequalities? So that's an area. So our last theme as part of the health inequalities work was to look at workforce, and this split into 2 areas. So the first area is really looking at training and awareness, making sure all staff have an understanding of health inequalities and how the research cycle links into that and areas for improvement. And then the other areas was looking at our staff teams as well, looking at things like recruitment and retention to ensure that the process that we have in engaging staff are in themselves equitable. So I think really that rounds up our 4 themes as part of the Health Inequalities programme and really sets the scene for the work that we are moving forward with to address health inequalities across research.